Mr. Chairman, let's start with the elephant in the room, Donald Trump's so-called big, beautiful bill. This week, Republicans in the House unveiled the largest proposed cut to the Medicaid program in American history. The bill takes a wrecking ball to Medicaid, making it harder to get health care and loading down the program with a thicket of red tape and bureaucracy. This approach is straight out of the playbook of for-profit insurance companies that Americans are totally and completely fed up with. Taken together, the bill amounts to $1 trillion in health care cuts, and most of it comes from millions of working people and even kids losing their health insurance. It'll also raise premiums for over 1 million seniors on Medicare. Now, Republicans say, of course, that they're cutting waste, fraud, and abuse out of the health care system. But the way this is going forward, that's just code for kicking millions of people off their health insurance. And my view is that this bill is yet another rationalization to get more tax breaks to the ultra-wealthy and multinational corporations. So I asked Mr. O'Neill to give a straightforward yes or no answer on whether he supports cutting Medicaid during his Finance Committee confirmation hearing. What he did was repeat the same tired talking points about how, in effect, only certain groups deserve health care. Here are the facts. These cuts to Medicaid are going to hurt kids, seniors, Americans with disabilities, and working families the hardest. Parents are going to get caught in a web of red tape requirements, and their children are going to pay the price. Kids with disabilities are going to see their home care options reduced or cut altogether, forcing parents to make agonizing choices about whether they can continue to live at home and get the care they need. Nursing homes will be less safe because Republicans are rolling back the requirement that a nurse is always in a nursing home 24/7. And make no mistake about it, the Senate, where so many of us represent large numbers of rural communities, those communities are going to be devastated. Rural hospitals are going to have to make tough choices between hiring another nurse or buying that medical device that isn't available anywhere in the county. Everyday Americans are going to pay the price for Trump's bogus agenda of cutting vital programs instead of taking on waste, fraud, and abuse. Mr. O'Neill endorsed that agenda. On top of it, he also endorsed Robert Kennedy's disastrous approach to the ongoing measles outbreak, which has now topped 1,000 cases. Worst yet, he appeared to share Robert Kennedy's appalling views about the life prospects of Americans with autism. I particularly want to condemn this idea of creating a national registry for those with autism. That is a dangerous road to travel down, and parents are scared about what the Trump administration is planning. Finally, I want to turn to Mr. Gary Andres, who's nominated to serve as the Congressional Liaison at HHS. Since Donald Trump was inaugurated, his administration has not provided a single meaningful response to dozens of inquiries. Robert Kennedy promised radical transparency, but all the American people have gotten is radical secrecy. Mr. Andres' current position in the House Budget Committee signed off on a Republican wish list of more than $2 trillion in Medicaid cuts. Many of those cuts have now made it into the bill that is moving through the House at present. These cuts are going to force rural hospitals, nursing homes, and other essential services to close their doors or turn away patients, leaving millions of people without the health care they need. Americans will die as a result of these cuts. I am not going to support nominees who are going to force American families to walk even more of an economic tightrope without the protection of affordable health care. I urge my colleagues to vote no. Thank you, Senator Craig.